Hello, I am Dr. Miski Sharif, SD7 in Obstetrics and Gynecology, having recently completed a 2-year fellowship under Mr. Alvaro Bedoya Ronco at the Midland Metropolitan Endometriosis Center. Here I present our poster, entitled #ENZIAN, Classification by Ultrasound Scan, the Key for Any Endometriosis Center. The #ENZIAN classification was initially developed for surgical staging of deep infiltrating endometriosis. It has more recently been validated for diagnostic imaging, namely with regards to MRI scanning and ultrasound scanning. And its use is now essential in the UK for the British Society of Gynecological Endoscopy Endometriosis Centre accreditation. The preoperative #ENZIAN classification by ultrasound scan provides a standardized framework which has shown high concordance with surgical findings. Below is a diagram of the #ENZIAN classification as published by Keckstein et al. Here we can see that findings are classified with regards to the peritoneum, the ovaries, and the fallopian tubes. More importantly, deep endometriosis is classified with regards to 3 main compartments. A, which looks at the rectovaginal space, B, the uterosacral ligaments, and C, the rectum. Since its establishment in 2022, the Midland Metropolitan Endometriosis Center utilizes ultrasound in the assessment of endometriosis. This is a well-described and recommended technique, in particular by the National Institute of Clinical Excellence. Our endometriosis ultrasound scan pairs the use of the International Deep Endometriosis Analysis, the IDEA Consensus, and the Morphological Ultrasonographic Assessment, the MUSA criteria, for diagnosis and stratification of the surgical approach. We audited over 100 of our cases correlating ultrasound with surgical findings. We were able to confirm a correlation of 90% for superficial endometriosis, 95% for adenomyosis, and 95% for deep infiltrating endometriosis. We have been able to limit the need for MRI scan to under 15% of our surgical patients, whereby only the cases where we found deep infiltrating endometriosis or frozen pelvis on ultrasound scan went on to undergo MRI scanning. Our #ENZIAN ultrasound feasibility study, looking at 18 British Society of Gynecological Endoscopy surgical index cases, found ultrasound to have a sensitivity of 12%, 0%, and 86%, and specificity of 100%, 100%, and 92% for #ENZIAN compartments A, B, and C respectively. Here we show 4 examples of our scan findings. The first shows a 4 cm endometrioma affecting the right ovary. The second shows an upper rectum nodule of over 4 centimeters. The third fulfilling the criteria for diagnosis of adenomyosis, and the fourth, a bladder nodule. #ENZIAN is the key for any endometriosis center, as it standardizes ultrasound, MRI, and surgical findings, and thus facilitates communication, auditing, and research amongst the multidisciplinary team. Our #ENZIAN ultrasound feasibility audit highlights areas for improvement, namely scanning for deep infiltrating endometriosis of the rectovaginal space and the uterosacral ligaments.